You're tuned into TobiTalks, Special Edition, Doctor of Nursing, Family Nurse Practitioner. Now you guys know I really like to get into the real on conversations or subjects. And the real for me is everyone is trying to go back to school, right? For a higher degree. And from what I see sometimes, I feel like a lot of people are just going back just to get the credentials, but literally I have no idea what they're doing. Especially when it comes to the role of Doctor of Nursing Practice. I mean, I've heard it so much, especially when they were changing from nurse practitioners going back and getting their PhD or their DNP. I really didn't know what that was about. I felt like, okay, more school. Y'all, I mean, how much of nursing can I really learn, right? Well, my guest today, Dr. Jessica Chung, drops all the details. I was so inspired by our conversation that it had me going back and looking at what kind of programs I can enroll in. Now, of course, that's going to be in the future because baby girl's still paying off student loans. But anywho, I am so excited for today's conversation because you're really going to learn about what a doctor of nursing practice actually does, especially when it comes to being a family nurse practitioner. And then on top of that, the programs that are out there. Like, my goodness, you can get a doctor's degree in a year or two. So I'm already talking too much and sharing too many details. Let's go ahead and hop into this conversation. I just really want to know what inspired you to even go into nursing? How did that come about?
So growing up in New York, my grandmother was a nurse. She attended Long Island University. Mm-hmm. And she actually went back to nursing school in her 40s.
Oh, so come on,
that will
Grandma.
encourage someone out there.
Mm-hmm.
So she was a home care nurse, and I would have to spend many summers and many holidays driving around with her to see her patients at their homes. And I just thought it was torture. I was like, why is my mom doing this to me? Why do I have to drive around with grandma all summer to see patients? But watching her take care of her patients, she was very meticulous, and she did awesome documentation. She wrote down every detail. And I saw the way she cared for her patients. So come time for me, graduating high school, I was like, oh, I'm going to be an accountant. Oh, no, then I changed my mind and I said, well, no, I'll try pre-med. And then finally, after my first year of college, I decided to go into nursing because I knew that I wanted to do something different in the way of helping people. And I've always loved science. So healthcare and health-related things, I always enjoyed learning about it. So I just decided to go into nursing after my first year of college. Of course, my grandmother was a big inspiration to me, she being a nurse and going back to nursing school later in her life. So it definitely motivated me to go into nursing.
And I know that you didn't just, go straight into BSN. You actually started from the associate's level, right? And you worked your way up. What encouraged you to do that? Because I really want people to know there's various ways to go into nursing, and it's not just hopping into the BSN route.
Yes. So I'm originally from New York, and New York, very competitive to get into nursing programs. So I actually looked at going into Long Island University, where my grandmother graduated from, and I had applied to their BSN program, and not knocking LIU. However, I felt like there were a lot of classes that they were requiring me to take that I did not need. Being that I had already did 1 year of undergrad, I had a lot of classes that I had under my belt already. So I went to New York City College of Technology, which is a CUNY school in New York. And it was a very straightforward associate's degree program. And that's what I wanted at the time. I wanted straightforward. And I knew going into the associate's degree program that I would go back for my bachelor's degree, which I did right away. So, and everybody finds their own way and their path of going into nursing. And that was just my choice, just because I really wanted to just go in and do the nursing program as efficiently and quickly as I can, and with the intention to go back for my bachelor's degree.
And I'm glad that you're sharing that because I wish I knew that. I only knew one route, which was BSN, which to me always felt like was more book heavy and not as strong and hands on, especially for us learners who are tactile and visual learners. I would love to be more hands on. And the feedback I've gotten from a lot of associates programs is like, you're really hands on, and then there's book knowledge, but you get that real live clinical experience that you really want to consume yourself with to become a strong nurse. So I'm glad that you're sharing that. So take me through your journey because, sister, you ain't hit all the levels. You went from associate, bachelor's, master's, and doctor of nursing practice. So I really take me through that journey. Like, was it your experience at the bedside that made you go through all these various levels in education, and what growth and experience did it give you to finally get your doctorate and stay in that field of this is where I specialize and this is what I'm loving that I do?
Yes, so I am definitely, apparently, I'm a professional student.
Girl,
So
dude, teach me some.
I definitely, I went into nursing knowing that I wanted to be a nurse practitioner. And I knew that I was going to do whatever it took to get to that level. I knew that straight off the bat. I said, I want to be a nurse practitioner. This is exactly what I want. So after I got my associate's degree, I worked. I worked as a nurse at a nursing home in Brooklyn, New York, and I also worked as a nurse case manager in Brooklyn. And in between there, I transitioned to moving from New York to Florida, and I decided to go back to for my bachelor's degree. And at that time, a lot of hospitals were offering tuition reimbursement for any associate degree RNs to go back for their bachelor's degree. So of course I took
Oh.
exactly I took that opportunity. I definitely took advantage of that. Went back for my bachelor's, but I knew that I was going for my master's. There was no doubt about it. I wasn't waiting. I wasn't wasting time. So I graduated with my bachelor's in 2012, 2013. Went back for my master's degree. Went to South University and obtained my master's degree, family nurse practitioner. And so after I graduated with my master's, I did obtain a position in a primary care office, and I did not have my doctorate degree on my mind immediately. I
Okay.
had heard about it. I had new nurse practitioners that were going back for their DNP, but for some reason, I put it way in the back of my mind. I said, you know what? I did all this schooling already. I have reached my goal. I wanted to be a nurse practitioner. I made it. And then one day, and this is why you have to have good mentors in your life. You have definitely have to have people who know you, but also see the potential in you. And so I actually was one day just at church doing something, doing ministry related. And my pastor, Pastor Collins, he walked up to me and said, you need to go back for your doctorate degree. And I said, no, sir, I didn't hear that from the Lord.
Right? Like, did he also give you money for me to go back? Did the Lord send
I
you that
said, no,
message?
I said I had just graduated not too long ago with my master's. I was making a good salary. Life was good. I was, not trying to write another paper. I said, I don't know. I don't know. I'll think about it. And he said, nope, you need to go back right now and you need to do it quickly. And so that was the beginning of 2017. So I said, okay, well, I trust him as a, a leader. I trust him as a mentor. I trust him as my pastor. So I decided, okay, well, if this is the path I'm going to take, I put stipulations on my doctorate degree. I said, well, Lord, you're going to I have to get a program that is less than 2 years, and I have to be done in a year or 2 or less years. That was my stipulation.
Mm-hmm.
So I had, and the next one was I had to either get in right away or no later than the summer of 2017. So
Wow.
spring semester had already started for a lot of schools. And so that only left the summer. I had looked at so many schools. I had missed the deadline for so many of the DNP programs. Many of them were over 2 years. Some of them were even up to 4 years.
Ooh,
And I said, well, if I'm in 4 years, I might as well go to medical school. But I said medical school wasn't my calling. That's not really what I want to do. And then I came across the school I attended, which was Stanford University. And they actually had a summer start date. And not only did they have a summer start date, they had a accelerated 1 year program. Now, this 1 year program is not for the faint at heart. I took took 4 classes per semester, but I knew that I did not want to spend an exuberant amount of time obtaining my doctorate degree. I knew that there were goals, there were dreams that I wanted to reach, and I knew that I just wanted to get going. I didn't want to spend a lot of time and dragging out school and just taking semesters off. I was very straightforward in how I wanted to do it. But with that being said, I obtained my doctorate degree, and I didn't realize how much more there was to learn in nursing going back for my doctorate. A lot of times people may look at it as just obtaining a title. It is so much more. If you're just going back for your doctorate, for your DNP or your PhD for a title, then don't waste your money, don't waste your time. There's
That's
so much
what I'm
more to
saying.
exactly.
And I
There's
think we
there's
don't
so much
know what those something are. Like, share with me the differences between, you were already a nurse practitioner. What is it
right.
more besides the credentials did you gain going to the doctorate program? Like, kind of,
Well,
share those sides for me.
definitely. Well, in the doctorate program, they give you what's called, well, at Stanford it was called a capstone project. So basically, in a way, you become a leader in nursing. You are literally developing a research project. You're the researcher, you're the data collector, you are the provider, you're the educator, you're everything. So when I initiated my capstone project, I was like, this is great. I'm going to go into a primary care office. I'm going to just do, a little project here. I'm going to be done. But you have to delve so deep into it that it really pushes you and it really motivates you to go into those areas of healthcare that you would normally go into. Like realizing, for one, I did my project on patient education and medication adherence.
Mm-hmm.
And it taught me so much because we hear patients don't take their medicine.
Yeah.
But
Taking the
you
wrong
don't really go
amount,
into
wrong dose, wrong day.
right.
Yeah.
But you don't go into the details of what's causing this problem. What's causing patients not to take their medication. And I found out it was simple. Patients just didn't have, or they didn't feel they had good communication with their provider. So doing that project for my doctorate program, it allowed me to even look at myself and say, okay, how can I be that provider? How can I be that nurse practitioner that communicates well, that communicates better with her patients? Because there's no point in me treating, diagnosing, and writing prescriptions if no one's getting better. My goal is for you to get better. My goal is for you to be healthy, stay healthy. And if communication is keeping that from happening, well, then I, as a provider, need to improve. So it allowed me to even look at myself as a healthcare provider and hopefully where I can teach and help other healthcare providers to communicate effectively with their patients. So it definitely opened my eyes to a lot, even my classmates, the projects they worked on. there's so much that you can learn, and you definitely don't want to limit yourself. If you're going to
Mm-hmm.
go back to your doctorate, whatever it is that you have a heart, a compassion for, whatever drives you, that is what you should focus on. That is what, be that expert at whatever it is that drives you. And so my thing is that educating, I love educating. I love helping people help themselves. I don't feel like, oh, because I'm a healthcare provider that, they should be dependent on me. If I help you get better and I don't have to see you again for another 2 years, then that tells me that I'm doing something
I know that's
to
right.
help you.
Mm-hmm.
So, yeah, that's my journey
Girl,
to
that's
getting my doctorate degree.
beyond your journey. You were really giving us an insight of what it's like to even gain that credentials. Like it's not just another title, but you truly worked hard for that. And the outcome is really helping resolve those issues that patients have with medication adherence. And we see it all
Right.
across the board, especially if you are in quality or if you are in, the pharmaceutical aspect. We see this a lot, and it's really, really like an area that we'll continuously see patients coming back in and in and in because they aren't following their instructions, or they don't understand what this medication is doing, or they have so many other medications that they can just easily get confused and be taking the wrong
Yes,
one, wrong dose, wrong day, kind of thing. So
exactly.
I really love that you actually did a deeper dive in that for your program. So when
Yes.
you were already a nurse practitioner, and you now changed your course to a doctor of nursing. I want to understand, I guess, the significance between that two. I mean, is it still the same kind of practice, and just this time you have a bigger title, or did some of the roles that you did as a nurse practitioner change when you got your doctorate?
Well, I still work in the same role as far as employer as a nurse practitioner. Um, the main thing for me as far as being a doctor of nursing is that I can open myself to any area, or reach more people with the title and the level of education that that I have obtained. So one thing that I definitely decided that I was going to do was use that knowledge and the skill set that I gained in obtaining my doctorate degree, and be that motivator, be that role model that I wish I had in nursing school. Because when I decided to go for my associate's degree, I did not personally know a nurse practitioner. I did not personally know a doctor of nursing. And I think that now, because the role has grown so much as far as the nurse practitioner and the doctor of nursing practice role, it has grown so much where now I have mentees. I have, I always have nurses, and even outside of nursing, other students and people in other professions that always ask me, how did you do it? What made you go further? I want to go back to school. I want to get my PhD. I want to get my MBA. So it's not just nursing, but anywhere where I can be that person that to motivate and encourage and empower other people. I think that's definitely what I get out of obtaining the doctorate degree.
Mm-hmm.
And there's so much that you can do as far as educating, teaching, professor, faculty, researching, publishing. There's so much you can do with your doctorate degree. And a lot of nurse practitioners are now, starting their own clinics and their own practice.
Yeah.
So it's definitely, doors definitely open. I mean, we live in a society where people, and it could be a good thing and a bad thing, where people respect titles. And it's not so much because, oh, you have doctor in front of your name, but people respect the fact that you took time to gain more knowledge. You took time to master what it is that you have mastered. So people look at that and they will gravitate towards that. And you want to be the leader of whatever it is that you you know. Whatever your skill set is, whatever your area is, you want to master it. You want
Yeah.
to know everything you can know, because you want to be able to help other people. So that's basically where I am, is that I want to be in a place where I can help others and motivate them, empower them, whether it be in or outside of nursing.
I love that. I really love that inspiration that you just shared, and the truth about it all, because there was a time where I know when they had changed the what was it, nurse practitioner program. They were grandfathering in those that wanted to do their DNP, and people just thought it was just another reason to just get more money from us, to get hot, to achieve a higher degree. And then on top of
Right.
that, there was doctors that were actually offended that a nurse could hold the title of a doctor, and
Yes.
there was a lot of confusion around that when this started to really come to light. What are your outlooks on that? Like, have you seen that kind of frustration? Do patients get confused when they see, you as a doctor? Do you have to kind of explain your role, or what? Or maybe the better way of asking this is, what does your role entail that's slightly different from a medical doctor as a doctor of nursing practice?
Well, as a doctor of nursing practice, with my specialty being a nurse practitioner, because you could be a doctor of nursing practice, and but not, be like a clinical nurse specialist, or uh, be in the education side. But as my role, I just see it as I just gained more experience and I've gained more education to help my patients. That's how I see it. And it's funny because my patients and people I even know personally have been calling me doctor way before I decided to go back for my doctorate degree. So it's funny because people always have called me like Dr. Jess, and that's like been my nickname.
Mm-hmm.
And so now I just like, it's really like for real, like, okay, I'm really Dr. Jess. And so I think that when patients feel comfortable with you and you gain that trust with them as a provider, it doesn't matter. The title, I mean, whether they see you as the doctor of nursing or if they see the medical doctor, if you have gained that connection with your patients, they're they'll call you whatever you want them to call, whatever you want them to call you, that's what they'll
Mm-hmm.
call you. But they're trusting you with their health. Their families are trusting you with their loved ones,
Yeah.
and that's what's most important to me, is gaining that trust with my patients, and also them seeing me as a real healthcare provider, not, I'm quote unquote, there's so many other names that they give nurse practitioners these days, but what is important that the world or healthcare sees, that nurse practitioners are providers. We
Mm-hmm.
we are the provider. We're not like, a sub provider. We're not like a halfway provider. We're not, the fill in. We're not a substitute. We are the provider. And the role that I work in, sometimes the patient will see me more than they will see the medical doctor. But it doesn't take from the medical doctor. It doesn't, you know, take or mean that I'm more important than the medical doctor. The reality is that the nurse practitioner role is needed in healthcare,
So
and
much.
the nurse, yeah, and then the nurse practitioners that decide to go back for their doctorate degree, they just want to do more for their patients. If your heart is healthcare and patient care, or whatever it is, health related, you are wanting to do more. You are wanting to go that extra mile to improve healthcare and improve the quality of it. And so that's how my role has changed.
And, since we already talking about improving, I wonder, did your bank account improve? Like, did this extra degree, bring in some extra income? Because I know going for all these degrees, I know that it could, sometimes what kind of pulls people away from wanting to go back is just that financial aspect. Like, okay, am I going to be able to, granted, I'm doing this because I truly want to bring more improvements into healthcare, and I want to be able to
Right.
deliver more to my patients, but I also need to make sure I can pay my rent and pay back these student loans. So I wonder
Right.
as well, like, does the advancement in the degree also benefit financially for you as well. So for anyone who is considering to go back to their doctor's degree, they kind of know what they're getting into in a way. You know what I mean?
Right. So I will say that I've been blessed. I'm very blessed. The company that I currently work for has blessed me phenomenally as far as pay scale.
Mm-hmm.
And I will say that a lot of companies offer something of the sorts like a clinical ladder type of scale. So anything that you do as far as improving your skills, there are companies out there that are willing to pay you for that. So no one should think that, okay, well, I'm not going to go back to my doctor because, I'm not going to make any more money. But you don't know the doors that can open for you. I mean, you can have your full-time job, whatever you do, and, there's a bunch of universities and colleges out there that are looking for DNPs to do adjunct teaching and clinical adjunct and clinical site visits. So, I mean, there's opportunities and doors that can open for increased income that you wouldn't normally see it with at just the master's level or a bachelor's level. So, but as I said before, if you go into it with, okay, am I going to make more money?
Mm-hmm.
Then you're kind of going in for the wrong reason.
Yes. I'm so
If you
glad
have
you
that
realized
mindset that I want to help and I want to increase my own knowledge and my own skills, I want to be better at what I do, I'm just going to keep it real. Money's going to come to you.
that. Mm-hmm.
If you have a mindset to help people and to give back, money's going to come to you. So, and as far as for me, like I said, I'm blessed. God has been good to me, and I'm definitely happy where I am. I would not go back. I would not change anything. I would not say I would not go back. I wouldn't do my doctorate. That was too much money. I'm already in student loan debt. I wouldn't change a thing. Not at all.
That's awesome. And I like that you brought out the fact that there's so many roles you can go into with your DNP, because sometimes people only think, oh, DNP, then I could just open a clinic or just work at the bedside. But we have a huge shortage. Okay. The nursing field has a huge shortage. Everyone knows that. We're short on nurses and we're short on those teaching nurses. And we're short on those that are up to date on nursing that are teaching us. So
Exactly. Right.
people who are going to, take that extra stride of becoming a DNP, and that's whether it's in research, whether it's in education, whether it's in practice. We need more educators, and we need more educators that are going to be current with the changes in healthcare. I'm not gonna lie, but if you still got a mannequin that don't move or speak or breathe, then you really need to reconsider your nursing school. No, I'm just being honest. I mean, we have technology now that, the mannequins are delivering babies. I didn't even know that could happen.
Exactly.
I did not know that could happen. We are using technology. We're using telehealth. We're integrating a lot of things in our communities and technology to bring better health care to not only, our patients, but across the world. We're changing developing countries as well. So it's like, we need more DNPs. We really do, to be teaching as nurses and bringing in, that are willing to bring in this innovation and changes of healthcare. I just, it breaks my heart when I know that there's still nursing schools that are kind of just, still learning things that Nightingale did. And granted, I love her. She dope. She dope. She's the one who got us where we are now. But, changes happen. Modern day changes in healthcare are completely different from Nightingale's age or from back in the day, 80s and 70s and stuff. So I love that you brought that to light, that there's so many other things you can do as a DNP, and it's not just have to be at the bedside kind of care.
Exactly.
So you say you work in a clinic already. Is that what I'm hearing? In a clinic?
I currently work in long-term care facilities.
So talk to me about your role in the long-term care facility. Because I know I've always heard that, DNPs or nurse practitioners end up being mostly overseeing the clinic because they're the highest provider there. So is that the same kind of role you have? Is it also administrative, or is it strictly patient care, or is it a little bit of both?
It's a little bit, well, as far as administrative goes, more so just my own administrative daily tasks that I do. But I do a lot of hands on patient care. So in the long term care facilities, I am that provider that sees the patients on a daily basis in collaboration with the physician. But as we know, the availability of physicians can be very limited. So, being that I'm available at the facilities, it definitely, one, it helps to keep the patients well. And two, it helps to keep patients, long term care patients, out of the hospital. And we know that one of the reasons that drive up healthcare costs is unnecessary hospitalizations. So I'm there and I'm seeing patients on a daily basis. If Mr. Jones is sick, I can see him right away versus, prior to this type of program, nurses would have to call the doctor, wait for the doctor to call back, give orders. But when you have a provider that's there at the facility ready to go, it helps the patient, it helps the nurses, it helps the family members. It definitely changes the course of what happens when there are acute changing conditions. So I definitely love what I do. I love being the provider at the bedside versus, being the provider that just gets the phone call and gives orders. Because every day I'm learning something new, seeing patients face to face and being hands on. I mean, there's no condition that's the same for each patient. There's no limit to what I'm learning. Every day I'm like, and this is another thing I just want to throw out there. With my DNP, I am still on Epocrates. I am still on Medscape. I am still learning stuff every day.
Come on.
So, learning does not stop because you have a terminal degree. So I love being the one that can help the patient and intervene at the right time, because we know how quickly someone can decompensate, and we know how quickly things can change in the medical field and patients start going down really quick. And these are long-term care patients. So this is their home. I'm working in their home, and I count it a privilege to be there.
Yeah.
They want to stay home. A lot of long-term care nursing home patients, they don't want to go to the hospital. Their family members don't want to see them in the hospital. So whatever I can do to care for them right where they are, that's what I aspire to do. And I love hands-on patient care because it keeps me going. It keeps me learning. It keeps my skills sharp. I still start IVs.
Oh, come on. You said, I don't, just because I got the doctor behind me does not mean I can't do my
I
skills.
still start IVs.
Yes.
So I love it because, the things I learned as in my associate's degree, I'm still using them now.
So how long was your experience in nursing? Like literally being on the floor before you started climbing up to be like starting as an associate, then going to your bachelor's, then going to your master's, and going to your DNP. Like how long were you spending, on the units or at the bedside? Because the typical stereotype is, before you can go to your DNP, you got to at least invest 20 years. It looked like you have a lot of
Oh,
experience from somebody teach you serious. So can you share with me, like, girl, like for real, like how long did you do all this?
so I graduated with my associate's degree in 2010, and I went
Stop.
back. Yeah,
Stop.
I went back for my master's in 2013.
What?
So that wasn't a lot. Yeah, that wasn't a lot of time. And then I graduated with my master's as a nurse practitioner in 2015. So I was an RN on the floor for a solid 5 years before I started working in private practice as a nurse practitioner. And I actually had a hiring manager tell me as an RN when I went for an interview at a hospital, and I told her I was going back to school for my master's, and at that time I probably had only been a nurse for maybe 2 or 3 years, and she flat out told me, "You don't have enough experience. You don't need to go back to school right now. you need to gain more experience. She basically just tried to
Shoot you
discourage me,
down. Mm-hmm.
shoot me down. So, and had I listened to that negative voice, I would not, there's not a shadow of doubt. I would probably, if I wouldn't be where I am right now, I would definitely be delayed in reaching my goal and doing what I know I was called to do. So there's no time, there's no limit, there's no cutoff age, there's no cutoff date, there's no cutoff amount of experience that that would keep you from getting or obtaining what it is that you want to obtain.
Can you
So
say it again? I want you to say it again for the people in the back, if just in case they didn't hear it in the back. Say it again. Mm-hmm.
there is no limitation. There's no age, there's no time limit, there's no amount of years of experience. Just whatever you want to do. Don't listen to the naysayers. There's always going to be naysayers. There's always going to be someone that says you shouldn't do that yet or you should wait. If it's something positive and it's something that you know that you want, you have to go after it.
Yes.
You have to go for it. And you can't let anyone talk you out of your dreams. You can't let anyone limit you. You can't let yourself limit you. You can't stand in your own way. Don't let fear get in the way of what you are called to do or what you have a passion and desire to do. As long as it's something good and positive, and you want to make your impact on society and the world, well, you can't let anyone tell you that you can't do it, because you need to tell them, yes, I can. And I left their interview and I did not get that job, nor probably did I want it anymore after you said that.
Thank you. Girl, bye. Keep your position. Bye, Felicia.
Exactly.
Not today.
So, had I listened to that, and I mean, I've had so much bumps along the way. I have stories upon stories of where I've been discouraged or where I failed at things or where I was afraid or, things that came, and life does get in the way of things. Just because you're in school doesn't mean everything else stops.
Yes.
I mean, family still is family. Family has problems. Money gets funny. Friends leave and walk away. Things happen. Okay, even while you're getting your degree. So don't lose focus. If you stay focused on what's important, and if this is important to you, then you have to go for it. And you don't let anyone tell you any otherwise, that you can't do it.
And this is coming from someone's grandmother who became a nurse at 40. So
exactly.
That
She
goes
didn't let
on either end or come through.
Exactly. And my grandmother, man, she was a fireball. She didn't let anything stand in her way. I mean,
Neither did she let you know that. Like, girl, you think them summer rides in the car was nothing. She has built you from the get-go, and you didn't even know. Like, this is...
I did not even know. I did not even know. And she was just such an inspiration to me.
And you were an inspiration to a lot of people who are listening to this episode because, that just for you being so authentic and raw and sharing, like, yeah, this was a time frame. Like, girl, 2010, 2008, that's 8 years. You've accomplished 4 different degrees. Yes. Good Lord. That is amazing. And the thing is, people will try to overshine that or say, oh, you're like, they want to put a cap to your experience and tell you when, that's enough. You can go to the next one. But you continue to use that fuel, that passion, that drive to change healthcare, to get to next levels. And I'm glad that you're sharing that because, we need to hear more of this, and we need to be more exposed to these different areas that we can do. And I'm really, really happy that you shared with me on what you do in your DNP, as a DNP, and just the pathways there. So what were some challenges you faced when you were in the program? Because it sounds sweet and nice when you get it. Just like when you get into nursing school, you're like, oh, yes, I got in. It sounds sweet. That acceptance letter is beautiful. But when you in there, you're like, what did I sign up for?
Right, exactly.
So what is that like?
Well, I mean, I've had challenges all throughout my education, but what the challenges that definitely stand out when I was in, getting my master's and finding those clinical sites. And I know there's a lot of nurse practitioner students that will probably listen and agree. It was a challenge, like to the point where I thought, this is not for me. I am not going to be a nurse practitioner. I'll just be a nurse administrator. That program's easier to get into. I won't need a preceptor or a clinical site. But I knew what I wanted, and I knew that I couldn't give up. So it was a challenge because doctors are busy, other nurse practitioners are busy. And when you live in a town or a city that's saturated with universities and nursing schools, it is hard to get a clinical site. It is hard to get a preceptor. And I faced that challenge where I almost had to decide what route I was going to take. It was either I was going to be a nurse practitioner, or I was going to have to choose a different route. I was given an ultimatum. Either you find a clinical site by this date, or you're not going to be in the program.
Wow.
And I mean, that was a challenge because this is what I went to nursing for. And here it is, my dream is like on maybe on hold because of something that you wouldn't think would be a challenge. And it wasn't because I wasn't smart enough. It wasn't because I failed, classes or anything like that. This was something that may seem simple to someone else, but it was a challenge for me. And one thing that definitely was a blessing is working in the hospitals. I had gained a relationship with physicians and other nurse practitioners. So I was able to eventually find a clinical site at that time to get into to start the program based on the relationship I built as an RN on the floor.
Mm-hmm.
So for my RNs and LPNs out there, build those relationships. If you know that you want to go back for a high degree and you know that you're going to need a clinical preceptor or someone even to write a recommendation for you, you want to build those relationships now. You want to build those solid relationships, and it shows people that you're driven and that they really have something good to say about you. They believe in you. They want to help you. That physician who doesn't really want to take another student, well, he knew that you took care of his patients in the hospital and you did a good job. So he'll precept you. So you want to build those good relationships now. So that was definitely one of my challenges. I mean, I've had so many challenges. I've had, even in the doctorate degree, at the beginning of my last semester, my grandmother, who inspired me, passed away unexpectedly.
Oh.
So, yeah, so that's why I say when you're in school, life doesn't just stop because all of a sudden you get your little degree. Life still goes on, and that crushed me because if there's not one thing I know that she wanted to see me graduate with my doctorate.
Yeah.
And there was not a soul who did not know that her granddaughter was a nurse practitioner and getting her doctorate degree. I mean, she talked about me so much. I was like, Grandma, you cannot brag about me like this. People don't want to hear about me. But she didn't care. She talked about me with everyone. So when she passed away unexpectedly, the beginning of this year, that was hard. I wanted to quit. I was like, I need to take a semester off. I can't finish this off right now. I can't do it. Emotionally, I was drained. Mentally, I was drained. I still had to, work full time. And I just couldn't, it just hit me so hard. There were days where I would literally open up my laptop to do work, and I would just sit at the laptop and just start crying because I couldn't believe that my world had changed so quickly.
Yeah.
Overnight, literally. But I had to encourage myself, and I had to stay close to the Lord, and I got through it because the Lord reminded me that he had a work for me to do, and that regardless of what his plan was for my grandmother's life, and he decided that that day was her day, I had to continue on and do what the Lord was calling me to do. So there's so many challenges in and outside of school that will affect how you do or how you perceive things, and will it get you off course or will you stay on course?
Whew,
So
girl, let me pass
hopefully,
the collection plate. Because you dropping all kinds of valuable, needed gems, especially those for those of us that are in healthcare and pursuing the nursing routing and going to
right.
school, especially students. Heck, if I had somebody like you when I was in nursing school, God Almighty, I probably would have went back and got my master's and all these other degrees, but it's just that taste is still in my mouth of nursing school, so I ain't there yet. But I have to say, it has truly been an honor and a pleasure to have you on here to speak about, the life of a DMP nurse and what that even entails and what you went through to become that, and just really going in depth and being transparent. And
Yes.
I know you're just this amazing, wonderful speaker, and I want people to know how they can reach you. Like, where are you on social media? What kind of platforms you have that you can share with us? So for speaking engagements or for motivation, they know who they can follow to keep them inspired on their journey to becoming a doctor of nursing practice.
Yes, I'm on social media. I am currently on Facebook and Instagram, and I also have my website. Everything is Dr. Jessica Chung. So Facebook, it's Dr. Jessica Chung, and Instagram, it's Dr. Jessica Chung, and that's DrJessicaChung. And you can also uh, go to my website, which is www.drjessicachung.com.
Yay! And I'll have this on my platform as well, because I want to make sure everybody knows where to get all the resources too. So you got it on this episode, and I'll also have it on TobiTalks.com. So I definitely want to say, Jessica, thank you so much. Hold up. I definitely want to say, Dr. Jessica, thank you so much.
Thank you, Toby.
For your time and just all that knowledge you've shared. You've inspired, girl. You inspired me. Not to go back yet, but you've definitely inspired me.
Just do it.
You've definitely inspired me, knowing that, hey, if I really want to pursue this PhD, I really can. Like, it's not impossible. Yes. If I want to do a research that helps change, the way we treat nurses, the way we teach them and stuff. And that's something to keep in mind. So before I get off, I want you to drop some kind of gem out there for any student who's currently in school right now, who probably just struggling to get through and needs that motivation. Or maybe there's a nurse out there on a unit that is like this close from like letting go of her license because she doesn't want to do it anymore. She's burnt out. What kind of inspiration and encouragement can you give any of those ranges to keep them inspired to keep going?
Don't quit. Keep going. I've wanted to quit so many times. And had I quit, back in 2011, if I quit back in 2015, if I quitted this year when my grandmother passed away, I would not see the fruit of the labor that I see now. So that's my gem. Don't quit. Keep going, because someone's depending on you to succeed.
I hope you've enjoyed today's podcast episode. There were so many gems dropped. But let's be honest. Who got time to replay, pause, and write down all that information shared? Shoo, I know I don't. But don't worry, I got you. Download TobiTalks app on Google Play for nursing resources, definitions, and so much more that were mentioned on today's episode. TobiTalk app features show notes that timelines the conversation and lets you click directly to the resource or definition. And it even lets you bookmark the gem for later. Listen, we're too busy learning how to save lives or even saving lives as nurses to deal with a replay button. TobiTalk app is your one-stop shop for podcast episodes and show notes. For more on TobiTalks, like the blogs and videos, go to my website at www.tobitalks.com. And I love to hear from you guys, so feel free to slide into my DMs on IG or Facebook and hit me up through email. That's tobitalks@tobitalks.com. Again, that's tobitalks@tobitalks.com. Till next time, I'll be talking to you soon.